so much for having us today, and we can get started with the, let's say, this. Yes. So our acknowledgements today, you have me, Ciarra Covin, Krista, Martel, and who's not here with us is our colleague, Olivia G. Ford, our editorial director at the Well Project. We would also like to acknowledge City Mitch, specifically the Building Healthy Futures Work Group, Vive Healthcare for funding BIBA, which is where the survey comes out of, and ETR, who helps us analyze and with our evaluations as well. So, and also so much thank you to everyone who completed the survey and allowed us to get here today. About the Well Project, we are a nonprofit organization who serve women and girls across this gender spectrum who are living with and vulnerable to HIV. We do this through education and information, community support, advocacy, leadership, collaborative engagement, and women-focused HIV research. Okay, we've gone through a lot of history today. Thank you all that went before us. You did a good job laying everything out. This.
I'm going to do this one.
Yeah.
Okay. We're kind of tag teaming. We're tag teaming a little bit, but I just wanted to point out that some of our work around breast and chest feeding started in 2018 at the Women's Research Initiative on HIV and AIDS, the WRI, which is a program of the Well Project. And during that meeting, we were talking about how U equals U applies to women. A couple of people, Lena and Carmen, were there. And it became really evident at that time that there was a lot of confusion about U equals U and breast and chest feeding. There was also confusion about our guidelines in the US compared to the WHO guidelines. And so that's when we started diving in and trying to address the need with fact sheets, webinars, conference presentations, and all sorts of different resources, which led to us convening a group in 2020 of different stakeholders. It was virtual, and that was, we had about 25 stakeholders, including women living with HIV, researchers, legal experts, clinicians, and others. And that resulted in the expert consensus statement on breastfeeding and HIV in the US and Canada. And basically was, pushing for more and better education for community and providers, advancing research, and recommending policy changes, including a push for the guideline updates.
All right, so in my role as Senior Manager of Community Programming, I had the honor of implementing BIBA, which was Building Equity, Ethics, and Education on Breastfeeding and HIV. That began in December 2021. And this was a multi-tier project that spanned over 3 years. And we were trying to enhance knowledge and broadening access to information regarding breast and chest feeding and HIV. And so much has come of that. In 2022, we were able to administer a survey that went out online using SurveyMonkey to evaluate the knowledge and perspectives of stakeholders, so different stakeholders. So that was healthcare professionals, women living with HIV, community advocates, etc., on infant feeding and HIV. We know before 2023 in the United States that the guidelines were saying to prevent HIV transmission, that mothers living with HIV were not to breastfeed their infants. And those guidelines did evolve over time, so it shifted to support and counseling and harm reduction. That approach for people living with HIV who choose to breastfeed despite intensive counseling. So grateful that that wording has changed. So once again, in 2022, the Well Project, we were engaged by the Infant Feeding Guideline Committee. In 2023, as we heard, those guidelines were finally updated by the DHHS panel. And then CDC adopted those updates as well. In 2024, in May, AAP, or the American Academy of Pediatrics, they then updated their guidelines. And then in September 2024, the CDC funded the UPLIFT study, which is actually a part of that protocol team as well, and with Emily, and I know other folks are in the room. but that was the first time that we were able to get some breastfeeding money to look retrospectively. I'm sorry, prospectively, sorry, wrong word, to be able to look at that in the United States, and it has been such an honor. I think the next slide is not me.
Well, so I think we've all been hearing from everyone about the updates, and so these are a few key updates about the guidelines. But I think one of the points that was really important to us when we were being asked to kind of give input on the updates for 2023 was to really point out the fact that CPS, or Child Protective Services, should not be called, because that was a huge part of the reason we got involved in this. Because even if the guidelines did provide some sense of support, even the CDC language at the time said, do not do this. And so it was the biggest threat to women who were even seeking or even mentioned that they were thinking about breastfeeding, would sometimes be threatened with CPS. So we were really glad that that got pointed out. We also, I think, tried to help influence the equity considerations in caring for Black families and other families of color unduly affected by HIV, social determinants of health, and conditions that may be alleviated by breast and chest feeding, as well as some of the guidance for transgender and gender diverse people, which may not stay, and with everything going on in the U.S., in future updates, we're not sure if some of those equity considerations will stay. Yep. Okay, so now we're getting to our 2024 survey. So we did conduct another survey in 2024, in February and March, and it was also to evaluate stakeholder knowledge and attitudes towards breastfeeding and HIV, as well as we wanted to see if the updates, it was conducted about a year after the updates were released, if they had any impact on healthcare provider support. So we also developed this survey with ETR. We administered it online, and the responses were de-identified and respondents remained anonymous. We mostly got this out through our networks and relevant listservs. The survey included 18 multiple choice and ranking questions, which were around demographics, awareness and knowledge of the topic, attitudes around shared decision-making, et cetera. And then we had 7 follow-up questions specifically for both healthcare providers as well as women living with HIV. And then 8 of the questions had optional comments, and we did receive a lot of qualitative data through those comments, and just 1 final open-ended question. Okay, so as you can see, about a little over half of the respondents, we had 226 complete surveys, a little over half were healthcare providers, about a quarter were people living with HIV, and then we had people who worked in an organization, public health professionals, and one thing I will point out is people were able, because a lot of people wear many hats, and so people were able to check more than one option. And then just a little bit of the demographic data, which is included in about both for healthcare providers as well as non-healthcare providers. So we've had, as you can see, in non-healthcare providers, we had about half were Black, African descent, or African American, and both for healthcare providers and non-healthcare providers, the majority of the respondents were women, cisgender women. Oh, and then I'll just add that the majority of our survey report from here on out concentrates on the healthcare providers.
Yes. So this was great to see that out of the professions, that 40% like medical doctors, and then to see what other professionals were able to participate in the survey: nursing, professional social workers, and then of those medical providers to see exactly where they worked. It was very helpful when analyzing the survey. I'm going to go to the next slide. All right. So in general, the majority of the respondents have heard about the updates, which is awesome. The main source of their information about the updates came from their workplace. So that being the 68% of healthcare providers and then 42% of non-healthcare providers. And then of those who were aware of the updates, 2/3 were mostly or very familiar with the changes to the guidelines. Higher level of familiarity among healthcare providers compared to non-healthcare providers. This slide is huge.
This is our big reveal. So as you can see, we asked, one of the questions we asked of providers was to indicate how supportive they were of breastfeeding when living with HIV, both before the guidelines changed and compared to after the guidelines changed. So this was like a pre-post retrospective question. And so 32% said that they were mostly or very supportive of breast and chest feeding and HIV before the guidelines, and that changed to 82% being mostly very supportive after the guideline updates, which is a pretty significant difference. I'll also just point out that as we had other changes, but 13% said they were not at all supportive before the guideline updates, and 0% said they were not at all supportive after the guideline updates. So it was a big shift in the level of support the providers that the guidelines had.
Yeah, and then they were able to identify the top 3 ways that they could support infant fetal decisions of women and other birthing parents living with HIV. Out of these, they reported that it was really hard to choose which were the top 3 ways because they're all important. So we had to initiate non-judgmental discussions around infant feeding options, provide evidence-based information on HIV transmission, then ensure that the parent and infant's entire care team is supporting the decision. But then the other choices included connecting women to a support network of community advocates and providing women with culturally responsive educational resources. Like I said, they were like, it's so hard to pick because everything is important. The top 3 obstacles identified was the lack of culturally responsive educational resources for women living with HIV, lack of support from others on the care team, and a lack of explicit policies in their institution or organization that might support breast to chest feeding.
So as I said, we had a lot of qualitative data, and so we just pulled out a few quotes. A lot of healthcare providers were saying that the guidelines are a big first step, but obviously there's more work needed to support patient-provider communication. Someone else commented that before the guidelines changes, it was stickier, so now there's more clear support and guidance. Another healthcare provider commented that how they're a critical component. However, clinicians need to operationalize them and ensure patients receive other support, including peer support, and appointment adherence, transportation, language services, so that they're not the total picture, but they paved the way for families, clinicians, and policymakers. And also just saying that it's crucial for providers to put this decision-making back into the patient's hands, which means providers must be thoroughly educated on the topic to avoid further stigma and misinformation.
All right. So from another healthcare provider, non-healthcare providers, sorry. I think there needs to be extensive education to medical providers on how to support infant feeding for people living with HIV. Many providers still have biases, including racism, classism, that needs to be addressed. And then this is a really exciting quote. Breastfeeding in South Florida is new. I'm actually one of the first persons living with HIV to do it. May I add, all of this was possible because of the research and data the Well Project has presented. Thank you for that. My doctor made sure everyone in the hospital knew that I was going to breastfeed, and I have support of everyone. That's so exciting. You want? Okay, you go.
We have 30 seconds. We have 30 seconds. So anyways, we'll kind of go through this quickly, but obviously educational materials are needed to address knowledge gaps, and I think this is both for community as well as healthcare providers. we need better institutional policies for breast and chest feeding. There's a lot of both anecdotal but other data that shows that, the need to be able to work with all the different caregivers within the woman's care, and then to promote non-judgmental dialogue. Next one. And so support ongoing research to keep addressing the unanswered clinical concerns, a lot of which centers around infant prophylaxis, testing schedules, mixed feeding, viral suppression. And I think, the big takeaway is just that we need to increase awareness of and expand upon this information.
That's it.
No,
Well, there you go.